The Vegas Forward podcast delves into the lives of the people in our community, uncovering not only what they do, but who they are. Business may keep our city strong, but it's the individuals that continue to create, innovate, and push Vegas forward. All right, welcome to episode 3 of Vegas Forward. Today we have my good friend, mentor as well, Dr. Jonathan Baktari, the CEO of E7 Health and Vegas Test Center, Drug Test Center, U.S. Drug Test Center, sorry. Dr. Baktari, tell us a little bit about U.S. Drug Test Centers and E7 Health. Let's kick it off there. Tell us a little bit about both organizations.
Well, E7 Health was the initial organization, and U.S. Drug Test Centers was a sister company that spun off because of the technology we had developed, allowing that expansion to occur. But E7 Health started as a project about 10 years ago. We started off as a very small preventative health and wellness company, mainly focused on vaccines. We were sort of like a COVID company before COVID existed. Okay. We did adult vaccinations, and we were in every industry that vaccines were involved, like employee health, student health. And then we expanded into drug testing, which was kind of part of vaccinations in a roundabout way for employee health and student health. And so we had the technology to do that nationwide, and that's when we opened up U.S. Drug Test Centers. That's
awesome. And so it was originally called the Vaccine Center when we first met, correct?
Yes.
And then you rebranded because you went more national, correct? What was your reasoning for the rebrand?
So the Vaccine Center, did a lot more than vaccines. Vaccines was the center of what we did, for adults. But we did physicals, we did laboratory testing, we did drug testing also, and we became somewhat pigeonholed where we get a lot of clients that would come to us for vaccines and like, oh, I didn't know you guys did drug testing. I didn't know you guys did physicals. Sure. So at a certain point, I think for branding purposes, we wanted to, let people know that even though adult vaccinations were at the core of everything we did a lot of other things around vaccinations to support those sort of books of business, as you would call them.
Got it. Okay, makes sense. Cool.
Yeah.
So it's awesome to hear your background, your story about your businesses. Tell us a little bit about your upbringing. Like, where are you from?
Yeah.
Give us a little bit about Dr. Baktari when he was a young buck.
Oh my gosh. Yeah. So I grew up in Chicago, really like inner city Chicago, and I really grew up at a time when, in Chicago, where even when you were 6, 7, 8 years old, you were out playing in the streets every day, all day long. Things that we would
the good old days.
Yeah, things that we never let our kids do today, right? But I can't believe what we actually did back then. And
sure,
you ride your bike anywhere you want when you're 8, 9, 10 years old. And,
and that's in Chicago too. That's not happening right now.
Right. Well, actually, I've gone back to some of those communities, and in retrospect, they were pretty. They were pretty tough communities in retrospect, even back then.
Sure.
But for whatever reason, we just didn't pick up on it probably as much as.
Sure.
And so, just grew up in Chicago, initially in the city, and then in high school in the suburbs in Skokie, and was there until I went away for college.
And then you moved to California as well later in life?
Well, so I went to Case Western for college and Ohio State for med school, and then Northwestern back to Chicago for my residency and internship, and then UCLA for my fellowship. So that's when I landed in California.
Gotcha.
By then, my parents had moved to Santa Monica or to California, and so I just wanted to be close to them. So I was there for a few years to finish my training.
Oh, wow. Okay.
Yeah.
So what brought you to Las Vegas?
You know what? I wanted to be as close to California as possible without actually being in California.
That's a common theme.
You're right.
Our last guest was a real estate agent, real successful. And we were talking about the mass exodus from people moving from California to Las Vegas, which is interesting. So,
right.
Yeah, avoid the taxes and,
Yeah, it's just, the crowds, the traffic, just seem like you wanted to have access to all that, but without necessarily, being in it. Especially in Southern California, which is, a lot of crowds, a lot of traffic. It's just a lot of stuff going on.
Yeah. And our podcast is all about like movers and shakers that live here like yourself, that are really building, creating, innovating in Vegas. And, what what do you love about the city? Like, what are some things you think are advantageous as an entrepreneur or just a resident in general that you think is unique about this town?
Well, I think when people think of Las Vegas, and I think that's probably the reason why like Vegas never had a sports team until recently, because everyone just thinks it's the Strip.
Correct.
And so what really is amazing about Vegas is it's much more than the Strip. It's sort of like thinking LA's Disneyland and that's all there is in LA.
Sure.
People have this view that, even when I moved here in the 90s, I think that was the perception that, are you going to be living on the Strip when you move there? And I think people miss out on the many opportunities there are here. You have really all the upside of a big city. Sure. Without necessarily
it's a small town still.
Yeah. You get to know everybody, one way or another. And, it really, I tell a lot of people, if you can't make it in Vegas, you probably can't make it. I mean, if you want to start something up and, like even in your case, if you can be, a innovative software company anywhere or a web design company anywhere, but Vegas gives you a lot of opportunities just because I think it's not as saturated and you can actually get to know people who are leaders in the industry and develop relationships. And so if you have a good product or good company, you can really launch it here and then the sky's the limit. Yeah.
And plus you have all the trade shows and different people coming from internationally, different, states and Vegas is a hub, so most of the things to do, a lot of companies test products in the market here because they're getting a good flavor of different areas and demographics. Right.
Yeah.
So,
well, I'm sure you've had this experience where you tell one of your new vendors where you're located, like, well, we'll be out in June.
Yeah, exactly. Yeah. People think it's so cool. Like, wow, you live in Vegas, They think about when they went out for their bachelor party. It's not the same,
and they think you're going to take them for the same kind of experience.
Yeah, they lost that 10 years ago, maybe. So, that's awesome. Yeah. So I did notice your resume, compared to anyone I've ever seen, is extremely extensive, both in education and your career, which I found to be interesting because usually I like to break down milestones, but yours was too large to break down. So, And my other question is, are you still paying off student loans?
No, thank goodness not. And truthfully, I hate to date myself, but when I went to school, I think, my med school at Ohio State was $3,000-4,000 a year.
Oh, wow. Those days are over.
Those days are over. I had student loans, but thank goodness they're gone.
Tell us a little bit about, you started off at Case Western for biology and psychology.
Yes.
Back before I was born, not to date you.
Okay, all right. Thanks a lot.
So tell us a little about your undergrad experience and then, moving on to Ohio State and the other places that you went.
Yeah, so I really wanted to be pre-med and do a science kind of major, but I didn't want to be your typical science guy. So when I was searching for another major, just psychology seemed to make sense. Back then you kind of, as a college student, you think, oh, psychology, I'll get to understand people. Nobody
will ever crack that nut.
Right. Yeah. So I think that, as a young person, that you're kind of drawn to that. So
sure,
I did both majors, and that was a really good background for everything else later on. And then after that, I went to Ohio State University for medical school, which was an amazing experience. I don't know how many undergraduates they have on that campus, 50, 60,000.
Huge, yeah.
It's like a city. And so it was really nice to get that Big Ten experience. And so it was, I think everyone should get that huge college experience, even though I was in med school, but you certainly got a flavor for it and got to see the campus.
Did you apply elsewhere? Were you looking at other schools, or what drew you to Ohio State?
Well, I was at Case, so I would get in-state tuition. I think that was a big drawback.
Yeah, there you go.
And I got to tell you, Ohio State is an amazing med school. I mean, they're ranked pretty high, but it is not for the faint-hearted. It was a very arduous. That stereotype of them, of med schools destroying their medical students in terms of work. It really was the case then. Maybe things have changed, but it was very rigorous. And, I kind of came out of Ohio State feeling, really well prepared. Everything else seems so easy.
What were your hours like? Was it like nights and weekends?
Yeah. Well, the first 2 years of med school are basic science. So you're in classes. And then the last 2 years you're in clinic.
Okay.
And I certainly remember some of those rotations where, you got there at 5 or 6 in the morning so you could pre-round on your patients.
Yeah.
So you could be ready for rounds at 7 o'clock.
Wow.
And and you had to know your stuff.
Yeah.
And the medical students were looked to, know everything by 7 a.m. Whatever happened to the patient overnight, you were supposed to report it by 7 a.m. So you really had to know your stuff, and you had to be really hustling all the time.
That's got to be nerve wracking as a young student to like actually be with real patients. And what was that like?
Yeah, I think a lot of that imposter syndrome that people keep talking about, because you wear a white coat, and I think the patients think you're a doctor, and when of course you're not.
Yeah.
And you're like, how did I even get here? First thing I'm just applying to some program. I fill out an application. Next thing you know, they're putting me in a room with people that think I'm a doctor. And so that imposter syndrome really, and it stays with you into internship. I remember when I was the first day at internship at Northwestern, I was on call. The first day they said, okay, you're on call tonight. Yeah. And I remember, getting a beeper back then and getting a phone call, my first phone call from a nurse. And, they call me and say, Dr. Baktari, that was weird to hear that. Sure. And they're like, something like, Mrs. Smith is short of breath, in room 302. Yeah. And the first thing I thought of, and this is really true, I'm like, why are you calling me? Shouldn't you be calling a doctor? And they're like, oh, wait, I am the doctor.
It's so funny though. It must be bizarre, right?
You can't believe it.
You're like thrown into it kind of.
Yeah. You're like, of course you have your resident that you can call, whatever, but that nurse calling you, you're like, hey, if this person is really sick, what are you doing wasting your time calling me? You should be, calling someone that really knows what they're talking about.
Exactly.
So
that's awesome. So you were at Northwestern, and then where did you go from there?
So Northwestern was for 3 years for internal medicine, and then I went to UCLA for pulmonary and critical care fellowship.
Okay. And then post UCLA, did you stay in California for a little while? And then...
No. So my first job, believe it or not, I got recruited to University of Hawaii as a quasi faculty position in their ICU. Oh, cool. And I spent 2-3 years there.
What was that experience like? What island were you on?
Well, I was at Queens Medical Center in Honolulu. Oh, okay. So it's the big University of Hawaii's hospital.
Did you enjoy living out there?
I did. It was got to see, obviously all the islands and that. And it was, and as a new grad, it was an amazing experience because I got to, get involved early. I think I was like their first or second faculty member that they hired. So I was getting in on the ground floor. It was a really good experience. I really enjoyed that a lot.
Cool. And where did you go from there, from Hawaii?
That's when I got recruited and got a position in Las Vegas with Pulmonary Associates. Okay. Which is, I think back then, one of the bigger pulmonary critical care groups in Las Vegas. So I got recruited here as a junior guy and then eventually became a partner. Okay. And And I noticed you're a medical director at the Valley Hospital System. Tell us a little bit about that experience. Is that more of a, are you day to day in the operations? Is it more of like you're on the board of some kind? Like what is the role? Well, so I did clinical for a while and then slowly I started doing more administrative stuff. I was chief of medicine at Desert Springs Hospital. I was head of the ICU for a year at St. Rose and then at a rehab facility. And so that kept opening more and more doors. And eventually I was medical director for Anthem Blue Cross Blue Shield for the state of Nevada and co-medical director at the Culinary Health Fund, and then system medical director for utilization management for the Valley Health System. So you were on the admin side. Were you still practicing on a daily basis or? Yeah. For part of that, I was practicing for the culinary and Culinary Health Fund and for Blue Cross, Anthem Blue Cross, I was half. Okay. But eventually I just transitioned to full-time administrative. And of course, in 2010, more of a CEO role at E7 Health.
Now, did you enjoy the medical life? I mean, what were the pros and cons?
Yeah, it's funny because it's always the grass is greener on the other side, right?
Sure.
So when you're in clinical, you're like, oh, look at all these people who are in administrative medicine. They're not on call, and they have a more comfortable hours and what have you. And then when you're on that side, you're like, wow, I miss clinical, and
sure,
I wish I could see patients. So I think the grass is always greener. I think it's simply, are you ready for a new chapter? I think you've done that. You've evolved from, one technology field to another.
Sure.
And I think so maybe you can relate to that. But like as you go, you're like, wow, I mean, why should my skills stop at this?
Yeah. Keep learning and
learning and what have you. I mean, you yourself can maybe talk to that about how, moving from one area, of technology, but still software development is a whole new, whole new animal.
Different. Yeah.
Right. And so, you're always challenging yourself saying, I wonder, what else I can do. Mm-hmm. And I mean, if I would say anything about clinical, I think a lot of doctors get stuck because they get trained to do that. That's what they know how to do.
Sure.
And the question is, do you want to get out of your comfort zone and go into something else when you're already really good at something?
It's funny because it's a common theme with the other people I've spoken to on the podcast, but also just other business owners in general. It takes a unique person to I always tell the team, it's always put yourself outside your comfort zone,
right.
Be in situations where you don't know everything, like this podcast. I don't know what I'm doing. You know what I mean? But it's fun, right?
Yeah,
and I wouldn't have known it was fun, and I enjoyed it until I did it, right? And I'm not comfortable, but it's kind of, that's how you grow as a person, both in business and also personally, right? So it's pretty awesome. So what one of the interesting things I think about your career path is you are classically trained in the medical field,
right.
And then you've moved over into the, let's call it the private industry, if you will, even though you had your own private practice. How did that happen? When did you decide, hey, I'm an entrepreneur. I want to create my own businesses.
Right.
At what point?
It's sort of, it was such a slow evolution that it's like, watching grass grow. There wasn't a point. It was always like, okay, let me do some administrative. Let me do some more administrative.
Sure.
Because at one point, I was doing clinical, and at another point, I was also on faculty at both of the med schools here in town. So I was doing teaching.
Oh, very cool.
And then on top
Toro too, right?
At Toro, I was clinical professor at Toro Medical School, as well as University of Nevada, and we taught the residents and interns, and I lectured at Toro's med school for the second year medical students. And so you start doing that, and then you get another opportunity to do something else, and it's one door keeps opening another door.
Sure.
So it's not like you wake up that one morning and saying,
I want to do this.
I remember being involved in administrative medicine at the hospital, and I get a phone call, hey, can you help us at Anthem Blue Cross Blue Shield, which was now going from clinical to being paid by insurance companies.
Okay.
And so it was cool because I got to see medicine from essentially the four pillars, which is clinical, teaching,
sure, as
well as the hospital side and the insurance side. So that gives you a perspective
of how the system works.
Of the whole, yeah. So in fact, we're talking about doing my own podcast or show, and one of the things that came to my mind is, I'm probably one of the very few people that can do like an expose on healthcare because
you've done it all. Yeah.
I've seen all four angles of it, teaching, clinical, the hospital, and the insurance side. And so you really get a sense for all the moving pieces.
Yeah.
And it also gives you an opportunity to figure out how to make things better.
Yeah. Because,
when you get to see it from everybody's angle, you can see where the problems in the system are. And I think that's been really helpful with E7 Health because, we write our own software for our own electronic medical records. And a lot of that is understanding, for example, that what role do the insurance companies necessarily play in software development in medicine? Because, the software has to make the insurance company happy.
Sure. Yeah.
And the software also has to make the patient happy. And the software has got to make the doctor happy. And and who gets priority in what as you're developing technology.
Yeah.
Obviously, every hospitals and doctors are very motivated by getting reimbursed, right? If they don't get reimbursed, nothing really matters, right?
Sure.
So they have to comply, and also government regulations. How do you comply with government regulations, Medicare regulations? So your software development and your technology has a lot of masters.
Sure.
And so what we did at E7 is, well, let's say we cut out some of those masters and focus on just quality and reducing friction for the patients.
Yeah.
And what would that do? And it was understanding all the angles that I think helped maybe formulate that strategy a little bit.
Yeah, and I always found that to be unique about you. I mean, you always think big, right? And a lot of doctors, because at Adlava, we've done projects for you name it. I mean, medical doctors, dentists, et cetera. And there's a common theme where a lot of them, maybe so they don't understand technology or have a passion for it, but they don't invest in their own technology. And I think that's one of the things, because I've been a patient of yours, gone down there for vaccines, et cetera. And you just walk right in, the system is all set up. There's a real set, smooth process. The staff is friendly. You go into the computer, you sign in, you fill out the form, and it's a lot of automation. You have the portal. What made you decide to invest in that? Was it mainly to, customer focused, to make a better experience for your customers? Was it the 4 pillars that you're talking about? A combination of both?
Yeah, I think it was an opportunity to understand where the friction is naturally in traditional medicine.
Yeah.
And realize, what's really important in terms of quality, in terms of patient satisfaction. I mean, it's almost like comical if you really think about it. What other industry do you walk in and they give you a clipboard with 30 pages of stuff on it?
Yeah.
That's just like...
It's frustrating for the customer too.
Right. But what other industry would get away with that?
Yeah.
I mean, if you were going to go get your hair cut and they gave you a clipboard with 30 pages, you're like, or what other industry gets away with, when you call the office, if you want to make an appointment, dial 1.
Yeah.
If you want your medical records, dial 2. And if you want
it's very impersonal.
And no matter what number you dial, they'll say, and we'll get back to you in 24, 48 hours. So like thinking
that could be done better.
It can be done better. There's something that screams out, better patient experience and quality too. I mean, we're not touching on that, but how do you improve, make sure, errors aren't made, like in a lot of our software development, it really doesn't translate into anything financial because, we spend money on things that prevent human error.
Sure.
So if you're going to, if a patient has an allergy to something, the option to give them a vaccine that they're allergic to almost doesn't exist because the system won't allow it.
Sure.
And so if you can automate some of that stuff, and get the human error component out. Now, generally there's not a lot of ROI on that kind of investment per se, of course.
But over time, it has a direct impact. It's easier for your staff, less paper, right?
And safer for the patients. I mean, so that's really, And the one thing I always say is it just turns out coincidentally that great quality medicine is the best business.
Yeah.
Just coincidentally.
Yeah, exactly.
Just providing amazing quality, just coincidentally is the best business. I mean, it works out that way.
And this town has a kind of a bad rap, almost like education for poor medical expertise. There's really some great specialists, but some of the generalists are not quite as good. Do you think that the fact that they don't invest in technology, automation, processes, could have a negative impact on the way the consumers look at the local medical field?
No, actually, that's a really untold story. The reason really is because we never really had a med school in Las Vegas. I think.
Interesting. Okay.
I think, there's most doctors know in town, Carson City fought for a long time to keep the only med school in Reno.
Okay.
And politically they I shouldn't say this, didn't want to have a med school in Las Vegas forever and ever, even though Las Vegas was the dominant city.
Sure.
So I think Las Vegas I don't know the stat, but it was certainly the largest city, 2 million or more that didn't have a medical school. Of course, Toro eventually came in to fill that void, but certainly even right now, they're just getting started with a MD medical school. So
when is that set to be completed?
I think they were already off the ground. They already have, yeah. But I mean, I don't think there's another city, and maybe I'm wrong, that has 2 million people and doesn't have a medical school.
That makes sense, though. That's definitely probably why, because it's a feeder, right? For good education.
And also people get trained here, go to med school here, and they do residency and they stay here. So most are essentially all the primary care doctors that we have in Las Vegas, for the most part, especially before Toro came, were trained somewhere else. So we had to bring them in.
Interesting. Yeah.
You look at like a city like Chicago has like 7-8 medical schools, I think, or more.
Yeah.
And so I think it's been a long time coming. So I'm happy to see it now.
No, that's awesome. So you have E7 Health and you have U.S. drug test centers. What's interesting too is you also have, commercial properties that you own, really successful strip mall down the street. You also have a gym, very diverse. How did you get into each one of those ventures? And do you find it challenging to manage and operate a gym and also manage and operate, the E7 Health, for example?
Right.
What are some of the challenges there?
I think, as you know, our style is to really have people in place that we're not going to micromanage. So you've met a lot of my staff and our we call them owners, co-owners. So I think it's all a matter of setting up systems where you let people do what they're good at and you get out of their way and you support them.
Okay.
I mean, that's really the strategy. And I've seen you do that too. And I think that's really a marker, just get out of the way, provide the leadership, provide the support, provide the technology, and then get out of the way.
No, I totally agree. And any reason why you picked those businesses or,
I think the real estate was just a function of, we just needed to house some of, almost all our things we have offices.
Sure.
So we, basically in a roundabout way, we own the real estate that we have we have our offices in.
Yeah.
So that just kind of was a natural extension.
Got it.
It kind of made sense, right? To kind of own, if you're going to be, people will say, if you're going to be renting, you might as well own it.
Yeah. And one of the things I've learned from you too, is you really spend a lot of time and attention to, SOPs and your process and, hiring the right people. How do you find the right person to work for you? I know it's a challenging thing for any business owner, but what method do you go about doing it, and what characteristics do you look for in the perfect fit for an employee of yours?
Well, you got to understand, the majority of people who get a job understand they're getting a job. So if I'm getting a job at the MGM, and I don't want to put the MGM down, I'm just saying, but if I'm getting just a typical job, I mean, I don't think MGM is expecting that employee to alter their stock price once they bring them on board.
Sure.
So I think is educating people, saying this is the kind of company we are, where if you come into our company, you can actually make a dramatic difference in our growth.
Sure.
And if you do, we're going to take care of you both professionally and financially,
which I've seen you do many times. Yeah,
thank you. Yeah. And I think so they have to know when they're interviewing, this is not a job where I'm going to melt into the wallpaper.
Sure. Clock in, clock out,
and show up and whatever. And I've said it before. If certainly when you're at the beginning, when you only have 3 or 4 employees, if they're not all LeBron James and Michael Jordans, it's going to severely reduce your chance of success.
It's true. Yeah.
But you got to let them know that, hey, if you're, again, we're using basketball metaphors here. If you're LeBron James or Michael Jordan, the sky's the limit for you, and professionally and financially. So I think it's that two-way street where you have to let people know that they're going to be essentially co-owners and you're going to take care of them.
That's awesome.
Yeah.
And it's the way to do it, right? It's how to build a good culture and a team. And and like you said, I have a small business, right? So you have one bad seed and it's a major problem, both, negative energy. You know, we've all stumbled upon those people, and it's all about finding a good fit, for the company culture.
What's interesting though, if you build that culture strong enough, the people that really kind of identify the people who are not fitting in are not the bosses, it's the other co-staff. Yeah. Where, and so if someone really just wants a 9-to-5 job and they show up and they look around and say, hey, wow, no one's clocking in and out here. Everyone's like, so it either forces them to reevaluate, how they're approaching it, or, maybe this isn't for me. Yeah. So it kind of, you don't even have to intervene after a certain point. The culture forces people to make a decision.
That's a great point, yeah.
It's like a fork in the road, right? Yeah. So you either like, wait a minute, there's a bunch of owners in this company. Everyone's an owner. Yeah. So it sounds like that's the only way to do it. So, hey, maybe this is a good time for me to be an owner.
Well, because I noticed that when I go to your business, because I go to your gym and I also have been to your clinic, and I don't see you there like hovering over people's shoulder, right? And but everyone is a professional, right? And they're focused on their role, and it has a lot to do with obviously the owner, right? Setting the tone for what your expectations are, but finding the right people that want that, and that's what I always look for in someone, because I always say, it's not my quote, but you can always teach someone how to do something, but you can't teach them how to have, great work ethic, caring when they come into work. Right. And you can't teach that. And I've hired people that instantly day one, they were off and running, and really setting their own destiny, right? Learning and growing, getting educated, because I'm here to support them, and so are you, to make sure that they have all the tools that they need to succeed. Right. But at the same time, inherently in them, they have to have that will and that drive, right? Which is hard. So
if I can paraphrase, I mean, what you say is something I always say. When we're going over a process, I'm like, well, we can teach you this process. We can teach you this software. We can teach you how to make a sale. We can teach you how to input data in. But we can't teach you to care. Exactly. Yeah. And I think that's what you're hitting on, where you can't teach someone. That doesn't mean you can't mentor people. Sure. Because actually, on some level, if you have had 5 jobs in a row where caring didn't matter. Yeah. And I don't want to, throw any particular industry under the bus, but just there are certain jobs where they just need you to come in, clock out, do a good job, don't piss anyone off,
move on.
And they're happy. Yeah. And they want more of those. So if you just happen to have those kind of positions and you come on to and get a job with Nick, you're like, well, the last 5 people were okay with that. Yeah. I don't know what this Nick guy is talking about being an owner. Because my last 5 guys were like, hey, you just show up on time. Don't piss anyone off. Get the actual work done. We're good.
But it makes such an impact when you're a small company, like, and that person, you have one person that puts in 110%. Right. They're the ones that see the raises that, they bump up, their role, like, and it happens time and time again. And that's one thing that I always stress.
Yeah. Here. Well, I always ask people, did I catch you at the right time in your life where you want to do that? Because honestly, I think in my life, there were times where,
you weren't looking for that.
I was just looking to clock in and out, maybe in my 20s or whatever. I'm like, whatever. I'm not going to I'm going to do a good job, but I'm not lighting the place on fire.
Okay. Just good enough to keep the job, right?
Good enough to keep the job, but I'm not going to light this place on fire. Sure. And so a lot of times is, did you catch them in that phase? Because if you look back at your life, and almost everyone, they'll remember there was times in their lives where they just wanted a job. Look, I want to I'm going to do a good job.
I worked at P.F. Chang's during the lunch shift. So
there you go.
That was not my...
Okay, but you weren't trying to improve P.F. Chang's stock price, were you?
No. You're like, they were lucky if I showed up most days. Yeah.
I'm sorry I didn't walk in when you were there. I would have been interested. But I think that's a good example. I mean, when you get a job there, I mean, you're not saying if I rock this world, P.F. Chang is moving up in the world.
Well, you feel limited naturally. You have that one specific role.
Right.
Maybe you get a better shift, right? But other than that, the manager's not going anywhere.
Right.
So you feel a little bit locked in. And I always want everyone here, and I know you're the same way, is nobody's locked into any particular role. You're a designer one day and you want to become a salesperson. Let's do it.
Let's do it.
Yeah.
Yes. To add to what you're saying, it's so funny how you and I have the same examples because, it's sort of like getting in at any level and then you can be anything. So almost everything is an entry level position in the sense that, like you said, you can get in as an administrative assistant and, be running the social media department, a couple of years later. Yeah. So every position is just to get into the organization for both you and I think. Yeah. And then once you get in, you can be
sky's the limit.
I just a really great example. I hired an 18-year-old 2-3 years ago, and I happened to be talking to the principal of my school and say, "Hey, do you know anybody that can do some scanning and what have you for a summer job?" Yeah. Just maybe a high school kid or something, that can scan, a few hours a day or something. We just had a lot of one project that required that. And we got her on board. And after 2-3 weeks, we're like, wow. Yeah. And now she runs the whole department at U.S. Drug Test Centers.
No kidding.
Yeah. Wow. And so you just saw it right away that, she wanted to light the world on fire.
That's awesome. Yeah. Those are great stories to hear too. It lets people know that it's possible. It's all about putting in the effort and the work for it. Right?
Well, yeah. I think a lot of people say, well, I've got this job scanning for a few hours a day for 3 weeks. I'm just gonna half do it and pray for the best. And she came in and just owned it. Yeah. And we're like, wow.
Yeah, that's awesome to hear. So let's transition over to the hot topic, obviously coronavirus. Yes. And as I mentioned before, you and I are friends too. So back in March, I think our last day here at the office was March 12th or 13th, which is, right around the corner, going to be a full year. Right. And I remember telling you, oh, this will all pass over. It's not a big deal, thinking that it was just all hyped up with the media and stuff like that. And obviously I was wrong. So what made you, I'm assuming it's your experience as a physician, right? You're like, no, this is much, much bigger. And
I think I said 18 months.
You did. Yeah. And why?
Well, because the last pandemic that I was in back in 1918, it took 2-3 years. So I just extrapolated. I just thought, well, gee golly. Yeah. No, I was the biology major. A lot of that was in microbiology, virology. I kind of get it. And we're in the vaccine business. Sure. We've been doing adult vaccinations and dealing with viruses. Basically a COVID company before the COVID came around. We were it. We weren't doing primary care. We were doing was adult vaccinations and preventing, vaccine related illnesses. Yeah. So when this came along, it was pretty obvious that it was going to be a pandemic. Our history of developing vaccines, which is how we normally traditionally deal with viruses, has been poor. It takes 5 to 10 years often to develop a vaccine. Yeah. Is
a lot of that due to red tape and politics and money, or is it just take that long for research? And why did it take so long before?
Well, I think first of all, it's multifactorial. I think a lot of the pharmaceutical company vaccine manufacturers, don't necessarily collaborate because obviously if they're able to pull it off. Also, there's a lot of risk in developing vaccines. We joke in the vaccine world, if you get a vaccine, if your child gets a vaccine and he doesn't wind up going to Harvard, you go back and sue the vaccine manufacturer.
Exactly. Yeah.
And so there's just a lot of liability in creating vaccines because, just like an aspirin, theoretically, everything has a side effect. The question is on balance, is there more benefit than potential downside? Yeah. And so a lot of the vaccine manufacturers are really limited. In fact, there was a super fund that we pay every time we buy a vaccine. We pay a little extra more that goes into a super fund that protects the vaccine manufacturers from lawsuits.
Interesting.
Almost like those super flood insurance and whatever. Yeah. And so there's a lot of risk, and I think a lot of vaccine manufacturers get sued left and right.
So they're scared to
they're scared
move fast.
They're scared to move fast, and they want to make sure, you know, which is good. I mean, on some level, but you know, are they occasionally overly cautious? Also, in all fairness, you know, we were able to create a vaccine in less than 12 months.
It's unreal, yeah.
And that was had a lot to do with two other things, which is the government support, financial support. Basically, they were guaranteeing essentially to buy the vaccine before they knew it worked. Yeah, especially with Moderna and Pfizer. And then the mRNA technology really hadn't been done for a vaccine, really. I know Moderna was playing around with it for 10 years for other things, for anti-cancer, whatever. But to be able to literally create an mRNA vaccine in 6 to 8 weeks and then go to clinical trials was a testimony to that new technology. Yeah. Yeah. And we had we mentioned earlier, the Spanish flu, 1918, and then there was H1N1 in 2009. What makes the COVID-19 virus so much more devastating than the other two, or at least H1N1? Yeah. Well, H1N1 was the flu, so it's not a coronavirus. But I mean, the coronavirus, you know, the COVID-19 is really a vaccine of a century. I mean, it's it's highly contagious, so it you know, easily spreads. Obviously, there wasn't a lot of natural immunity for it prior to it. Sure. And this mode of transmission is, you know, what humans do the most: congregate. Sure. Yeah. Right. Yeah. I mean, it's not, especially in this town. Yeah. Or you know, in a lot of countries where everyone's kind of condensed. Yeah. So I think when you get a virus, which the mode of transmission is basically humans congregating, you know, that's a recipe for a worldwide pandemic. Yeah. So I think the COVID-19 vaccine virus is the virus of, you know, of a century. I mean, it's not one that's we've seen lately, and it was devastating. It's too contagious. It's too easily transmitted. Yeah. And so here we are. And you notice a lot of the immunologists and experts, you know, when it first came out, they could look back at H1N1 or the Spanish flu possibly. And, but there was a lot of confusion and, you know, decisions that were made that were kind of came off as flip-floppy, right? And but they didn't know, right? I mean, do you feel the same way? Like should they have known more, or was there not another case study in the past that was similar? Well, I mean, we had the first SARS and the MERS, which happened in the early 2000 and then I think 2009. Yeah. So we had some experience, but those went away. Yeah. They just kind of fizzled out. So we had a little bit of experience, but I don't think we understood it as well as we do now. I think what was also intriguing is, you know, how it impacted the elderly versus young people. Yeah. You know, the flu is a lot, you know, like children can get the flu, teenagers can get the flu. Sure. It really was a different upper respiratory type of pathogen, which had the biggest devastation on the elderly and people who are compromised. Yeah. In a much more devastating sort of way than we've seen with anything else. So what were your thoughts? Because there's some controversial topics like, should we shut down? Should we not shut down? Should we wear one mask, two masks, no masks? Would you have handled it any differently if you were Dr. Fauci, for example, early on, or even, you can't say early on, because let's say in retrospect, do you think the shutdown was something we should have done? And what are your thoughts on masks and things like that? Yeah. Like what would you have done differently is, you know? Well, you know, it's you don't want to be a Monday morning quarterback, but sure. The one thing I don't think I ever really understood is a much bigger emphasis on protecting the vulnerable. I mean, if you really think about it, if you really, really thought about it, if we locked up everybody over 50, literally, and anybody with pre-existing conditions, let the economy roll, you know, otherwise, as long as the people who are younger were not then, you know, exposing themselves to the elderly. Sure. And I think that's where the lockdowns came from. I think there's inherently nothing really wrong when you look at the statistics with younger people, getting COVID. But I think the problem is they get it
and transmit it,
and they go see grandma.
Exactly.
Okay. And they go see grandpa, or they go see somebody with an underlying condition.
Yeah.
Because if you look at the death rate among younger people, obviously it's not as big of a concern.
Sure.
So I think, were there ways to surgically protect the immunocompromised and the elderly from those younger people?
Yeah.
I don't know if there was enough strategy devoted to that.
Okay.
Do you see what I'm saying?
Totally.
If there's a real campaign, because, and by the way, there were people, the younger kids who didn't wear masks, didn't do anything, a stronger level of education saying, fine, if you're going to do that, okay, we can't, whatever, but, stay away, from people who are going to be at risk.
Yeah.
And even with everything we did, even if we added that as a campaign, so if you're going to go and hang out and go to parties and whatever, okay, just have a little responsibility.
Sure.
That you do not then go visit someone or.
Yeah, it's vulnerable. Yeah.
That's vulnerable.
Yeah.
And I think I would have liked to seen a little more of that added to whatever we were doing.
Yeah.
If that makes sense.
Yeah, because it's so funny because you see, one of the things I noticed from coronavirus is how the states had so much control. Like you have Nevada, we're doing lockdowns, and then the state over, depending on the, if it was a Republican or a Democrat running in office, and how politics kind of impacted, how they treated their constituents or what percentages there were. And, one of the things I always wonder is with masks, like, is it making a big impact? And nobody maybe knows now, and maybe there's not enough data on it.
Well, so the masks make a difference in the sense that, it prevents one way of transmission. So, the coronavirus is transmitted by big droplets. So, so if you're
coughing,
talking,
sneezing,
or even if you're speaking, you're generating droplets.
Yeah.
So to the extent that they can capture droplets, it would be effective. And so, even if there's, you use a hockey analogy.
Sure.
If the other team has 3 ways to threaten you, 3 great players, shutting down one is not such a bad thing. Now you may say, well, but I'd rather shut down one than to let all 3 kind of have their way.
Sure.
So I think, getting rid of these large droplets is a win.
Yeah. Oh yeah.
Right.
Yeah.
But the problem is, unless you're wearing a N95, you're not going to be able to prevent the small ones, and even a good fitting one. So I think, we can't throw out the baby with the bathwater. I think wearing masks obviously catches all that.
Yeah.
And especially more so for the person who's actually infected.
Yeah.
If they're infected, it's actually going to protect someone else. So I think it's shutting down or helping reduce the large droplet transmission. Masks make a difference. Yeah. But ultimately, if you want total protection, you'd have to get a form-fitting N95 mask, which will then, capture the smaller droplets. So,
and the problem is the public isn't, used to properly wearing masks, right? And handling masks. I know I'm terrible at it. I'll go into Starbucks, put it on, throw it in the side of my car, grab it, go somewhere. You know what I mean? It's not, that's not the way a doctor, they go into your patient's room and they throw that mask away, right? And there's a certain way to do it. And so.
Right. And also the N95 in the hospital setting, you actually go and you're fitted for it. Yeah. And also, having a beard, whatever, can actually break the seal. So there's a lot of ways that you have to wear an N95 correctly to get the right fitting, as well as to make sure, there aren't gaps and what have you. So I think masks are a good thing. Yeah. Obviously. But I think I don't, and I know we've both met people who were like, well, I wore my mask everywhere. I don't know how I got it.
Sure.
And that's probably just because it's not 100%.
Of course. Yeah, nothing is. Yeah. I mean, and so it's like you said, using the sports analogy, picking your battle, right? And obviously it has an impact. I think one of the things that bothered me as a, regular Joe is the inconsistencies of, between different states and between different establishments. Like, why are the restaurants so bad, right? But then other, you can go into Walmart and, put on a mask and there's no occupancy limits and things like that. So that was frustrating.
Some of it is arbitrary.
Yeah.
I think a lot of the governors were just, some were arbitrary, some were based on science.
Yeah.
And they're just trying to, what they think is the best decision.
Do you think that'll make an impact if, God forbid, it happened again? Will there be more of a national mandate, you think, off the bat versus letting the states control the decisions? Or, I know it's kind of more of a political question, but just curious how they'd handle it differently if it happened again.
Well, I think the government's federal role, instead of being more in control, I think they have an obligation, which is more obvious now, to be prepared.
Yeah.
I think, if you remember early on, the fact that we didn't have masks and PPE, I think we should have our own reserve and sort of a tsunami warning system for the next pandemic,
Sure.
So if you've ever been on an island, they have a whole system, with things that warn you and have an action plan and what have you. And I think, not outsourcing all our masks to other places and having enough in case it were to happen. I think the government can really make an impact, the federal government, by really working on preparedness for the next one.
Okay. Now this is there's a lot of controversies and conspiracies that came around. One of the most famous ones was the Bill Gates conspiracy, or he's going to put like a microchip in your brain. And I don't know who makes this stuff up, but educate us, from a professional opinion, an expert's view of the different vaccines, the differences between them. And do people have a choice of which one do I want the Moderna versus the Johnson & Johnson one, tell us about each one, the options and
Okay. Yeah. Well, in the United States, there's only 3 that have been authorized. So we have the Moderna and the Pfizer, which are one class of COVID-19 vaccines. And then we have the new Johnson & Johnson. In terms of getting a choice, I don't think most people have a choice. Depending on how you're getting it, they're going to have one or the other. And I think the strategy right now should be to take the first one that's offered to you. Okay. Because while you're waiting for the one you like, you could actually get the virus. Sure. So that would not be good. Yeah. So the strategy is, because all 3 are effective in essentially preventing death, which is the worst outcome. Yeah. So I would take the first one that's offered to me. What the difference between them, of course, is the Pfizer and Moderna are mRNA vaccines, which means, they just take the genetic code for the spike protein, which is on the virus, and they put it in a soap bubble, a lipid particle. Sure. And they inject it into your muscle. And that, believe it or not, that genetic material goes into your cells and they start producing the spike protein. Your body sees the spike protein. It thinks it's seeing the whole virus. So that's one way. And then Johnson & Johnson does it a different way, where they actually take a cold virus that can't replicate. They put the genetic material into the cold virus. So you kind of get the cold virus into your arm. Okay. It releases the genetic material into your cells, and you, again, produce the spike protein and develop antibodies to it. So both ways we're injecting genetic material into you for the spike protein. No microchips. No microchips, not yet. But then your body either way produces the spike protein. And as I always say to people who are wondering whether they should get the vaccine or not, assuming you're going to see the SARS-CoV-2 virus, would you prefer to see the whole virus, or would you just prefer to see the spike protein of the virus? Yeah. In other words, either way, if you get infected or get the vaccine, you're seeing the spike protein. You just want to know what's going to be behind the spike protein, nothing or a virus. Yeah. So that's why I encourage people, if given an opportunity, to take one of those 3 vaccines. Gotcha. And you were vaccinated, correct? I was. I got 2 doses of the Moderna vaccine. How did you feel? The first shot, okay. The second one was 24 hours of
Yeah.
Just kind of really being lethargic.
Yeah.
Which is very common.
Yeah, which is common from any vaccine for the most part, right? I know when I got my kids vaccinated, they can get a fever and things like that.
You can.
Yeah.
I think these have a little more oomph than most. Yeah. Compared to most flu shots I've gotten and stuff, but they're a new technology too. So it just may be that they have a little more of that first 24-hour side effect than most.
So you don't have any concerns like long term? I mean, I know that's something that people come up like because there's not enough data that hasn't been,
Well, I'm just thinking of it as a molecular biology. I mean, basically they're injecting, like the Moderna vaccine,
mm-hmm.
they're injecting the RNA for the spike protein into you.
Mm-hmm.
If I got the virus, I'd get the whole genetic material, including the spike protein.
Sure.
I'm just trying to figure out what long-term side effect. Would you like to see the whole long strand of the DNA of the virus?
Or just a part?
Would you like to see just a little portion that's... So It's not like... I think people say, well, I'm not getting the vaccine. Well, that doesn't mean you're not going to get to see the genetic material of the SARS-CoV-2 virus anyway.
Yeah.
It's not like I'm not going to get the vaccine and I'm not going to be exposed to the virus. So if you think of it that way, that you're I mean, if you think, 25, 30 million people in the United States have documented, exposure, with a positive test. And if you assume that for every one person, there's 3 to 6 people who got it and didn't go get tested.
Yeah.
We're talking about 100 to 150 million people in the U.S. who've already had the opportunity to meet the SARS-CoV-2 virus.
Yeah.
So it's not like, I'll never, that's such a low likelihood I'll see it. More than likely, you're probably going to see it one way or another.
Sure.
So why not get the spike protein first?
That makes sense. Yeah, because I'm pro-vaccine. Always have been. Both my kids are vaccinated. I get in fights with some family members, not to be mentioned. As to whether or not they're good for you, and you hear all those rumors. But I believe in medicine and modern medicine, right? And so, but my family and I got coronavirus in November, and I was mostly asymptomatic. I sneezed, and luckily, knock on wood, nobody got violently ill. I have a 3.5-year-old and a 1.5-year-old. They both had fevers, and then the next day they were back running around. Destroying the house. And my wife was lethargic, and tired. But I second guess, and my wife and I talk about like, are we going to get the vaccine? Even though we're pro-vaccine, it's like, okay, I've had it, I experienced it. It didn't have a big impact. Not saying the second time wouldn't. What do you say to guys like me? I mean, I know you feel like, hey, everyone should get it. And then you and I are friends. You know me well, and I'm like, might let the vaccine marinate a little bit before I jump in and get it. Right. What do you say? Because I'm sure I'm not the only one. What do you say to people like myself?
So the guidelines is that even though you're protected because you were exposed, that this is going to also protect you by getting the vaccine. But I certainly get that. I mean, you have a certain amount of immunity. We don't know how long the immunity from catching it is going to last versus the vaccine immunity, how long that's going to last. And so you can make the argument, well, I'll wait until that data is available. Eventually that data will be available. How long do people's immunity who got the virus last, meaning prevent a reinfection, versus people who got the vaccine? How long does that immunity last, meaning preventing a reinfection?
Sure.
And then you could take it to the next level is how long does the immunity last for people who got the virus and the vaccine? So that data will come out eventually.
Sure.
Right.
Yeah.
So you can make the argument saying, well, I'm willing to hang out until we figure that out.
Yeah.
And wait and see. And so, but this current recommendation is you get the virus. But if someone were to say, I want to see the data for which immunity will last longer, I could see that.
Yeah. So when do you, some of the local economy and just the virus as a whole, like when do you see this coming to a quote unquote end?
Right.
And where do you see Las Vegas going when that happens?
Yeah. Well, it goes back to some of the stats we were talking about earlier. If you believe 30 million Americans have a documented infection.
Yeah.
Okay. And that's what the data is showing. And if you believe there's a multiple of that are undocumented infections.
Sure.
So we're talking, maybe 100 to 150 million Americans have already been infected, if you believe that.
Mm-hmm.
And then, we're up to, I think, about 50 million people have already gotten one dose of the vaccine. If you believe that number, we're fast approaching 150 to 250 million people that have some form of immunity potentially. And in the next 60 days, there's some news out there that, there'll be ample vaccines for everybody by, I believe May. So if everyone really has access to the vaccine, things should be looking good. There's only 2 curveballs that I would keep in mind. I mean, if these 2 curveballs don't occur, then I think we're good. I think that the curveballs are, will eventually a variant or another strain come out that's not covered by the vaccine. So that's the curveball. That
sure.
With that,
how likely is that? I mean, nobody knows, right? But
we know certainly like the variant from England is covered for the most part by the 2 mRNA vaccine, Pfizer, Moderna, and probably the AstraZeneca vaccine in England. But we still don't know about the South African variant, and we still don't know about the Brazilian variant. But putting those 2 aside, if those variants are covered and we can get herd immunity, that's going to look good. And then the last thing, I think the unknown is how long will these vaccines confer immunity? But even then, both Moderna and Pfizer are working on booster shots to cover the variants. So if those 2 things, don't come to fruition, meaning a variant that's not covered by the vaccine or the immunity just kind of peters out, then I think we're looking good. I mean, I can't see a scenario where this summer should be pretty okay. I don't know when some of these mandates will be removed or when things will be normal.
Sure.
But if everybody in the United States has access to a vaccine come May, I think things are going to be looking good. I think it's going to be much better.
Sure.
I think we're going to see a lot more opening up of states that are locked down and more opportunities for people to get together. Yeah,
I'm noticing that too. I was out like 2 Fridays ago and I was at the Red Rock Casino over the weekend, which you'd probably shoo me on not to do, but
that's okay.
It was busy. I mean, the restaurants were packed. I mean, casino was vibrant.
Did it look like 2019?
I don't know if I'd say that yet, but it's getting there. And I don't know if it's people being just fatigued from being indoors and they're just like, screw it, I'm heading out, or if they've, like you mentioned, they've already gotten it or they had the vaccine. But I've been noticing a positive change, and a lot of people we've talked to have talked about referencing it like it's going to be like the Roaring 20s out here when it happens.
There's a lot of pent up. I mean, almost everyone I've talked to has these pent up vacations planned. I mean, they're just like writing them all down. We're going to do this. We're going to. So if that's true, there's going to be a big roar back to you won't be able to get a hotel and that kind of stuff. Yeah,
which is exciting to know. At least there's like light at the end of the tunnel, and I think even if we're I'm totally fine with wearing a mask. Like play by the rules because it impacted my business quite a bit, and so that's scary, right? Putting food on the table and things like that. So whatever the rules are, follow them.
Of course, 100%.
Just to kind of move on and move past it.
Yeah.
But I think there's it may not be over by the summer, but as long as we see things progressing. And we start seeing trade shows come back. And I know like the live theater shows and entertainment venues are starting to slowly open, I think, here soon.
Well, even the Golden Knights opened up recently. So with the partial bans. Yeah. So I think by summer we will see, I don't think it'll be back to normal, but I think we are going to see some openings of stuff. Yeah. Which kind of makes sense, especially if those 2 other curveballs don't come into play.
It's funny. I remember because you and I have Knights tickets together, and one of the funny things was we split the season. So I had a big concentration of games like in February and the beginning of March. And I was like, man, I'm so sick of going. You know what I mean? Because you're like, it's like, oh, it's a game Monday, Tuesday, Wednesday, and Friday. And now I look back, I'm like, I'd kill to go to a game. I mean, those are some of the best times in town,
It's so funny because I killed a few months ago, I would kill to go get a haircut.
Yeah, exactly.
Just to get
like the simple things.
Those simple things I would kill to go fill up my gas.
Which is awesome because I think people, you naturally take things for granted in life. And I think, when you go through such a traumatic experience, you're going to appreciate the small things.
Oh yeah.
Which is exciting.
Yeah. I mean, just go into the mailbox and get your mail. Wow.
Yeah, exactly. But so let's hop over some personal questions and things like that. What are some things you enjoy doing, outside of work? I know you're a big Knights fan. What are some things you love doing in Las Vegas or even around Las Vegas?
Yeah. Well, we're obviously, we're huge sports fans and hockey fans. So that's a big part of what we do. And then I spend a lot of time with my kids. We're really,
too much now, right?
Yeah, too much. We've gone to Red Rock. We do a lot of fun stuff.
Awesome.
And then we're really into traveling. So I try to take my kids to different places and just see different parts of the country. And especially in the summers when they're off school, that's like a
perfect time. Yeah.
We just, boom, boom, boom.
Any plans for when things open up yet? Or
we've just typical, try to get them to Florida, Southern California.
Nice.
Yeah.
That's awesome.
Yeah.
So jumping back to, because you're a teacher at the universities, what are some advice you'd give to, up and coming medical students about their career? Maybe some things that you did incorrectly that you would have done differently. I know you mentioned Ohio State, like you'd really recommend going to like a big school. Yeah. What would you say to, Joe medical student?
Well, I think the thing that medical students need to understand is it's evolved and changed. I think the old days, people went to medical school because they liked autonomy. Almost everybody that I went to medical school with had this vision of them having a private practice and, being their own boss. And a lot of people gravitate towards medicine because of that. They don't want to be, employee number 132.
Sure.
But I think those days have changed and already. Yeah. I think the likelihood that if you finish medical school, you'll be working for someone. Yeah. And I think that realization, I'm assuming, has hit, or if it hasn't, it should hit. Yeah. Because the likelihood that you will be working for yourself is very small. Yeah. And that's completely changed. Yeah. So how people view medicine, I think the independent streak of people where I'll be able to have my own values and my own practice. And, hospitals are buying up practices and corporations are buying up practices.
Is that what's happening, causing that?
Yes. Yeah. There are very few solo practitioners around.
Interesting.
So you're essentially, statistically, I don't know if I have the data immediately to back that up, but I think if you graduate in 2021, you're
it's a whole different world.
You're going to be working for someone.
Did you see the writing on the wall? Is that why you kind of ventured out and did?
Well, that's not why I did, but the writing was on the wall. I mean, you could see it coming. I mean, it's all about, how do we, control physicians' behavior, and there's only so much you can do to play with reimbursements. At the end of the day, why don't we just employ them? Yeah. And then we control everything. Yeah, sure. And so obviously not the medical decision making, but the other parts, the business end of it, I think people want to have more control over physicians in that sense. So I think it was a natural evolution.
When you were young, did you envision doing the things you're doing now?
No.
In what way? Like what did you think you were going to do or be? I know it's a loaded question. Yeah,
right? That's a loaded question.
Did you always want to be a doctor?
I always want. Actually, I love sports a lot, so of course, that's what we dream about. But,
and then you went for your first run. You're like, that's not going to happen.
That's not going to happen. No, you don't know. You're naive. You just think I'm going to help people. Yeah, and which of course you do, but you don't think of the business end of it. You just think, oh, this is a field. Which is nice because you say this is a field where I can make an impact. I can help people. Yeah. Growing up watching the shows I did, it seems like the physician was just a family advocate, and we're helping people in the time of need, and luckily I've been fortunate to be able to do that. I mean, you really can make an impact. I think one of the things that I mentor young doctors is how much your patients are hanging on to every word you say.
Oh yeah, yeah.
And your kindness and compassion can drastically alter the viewpoint. I think people forget how people view physicians. They view physicians somewhat like God sometimes, especially the older generation. And so I teach my residents and my medical students, just be careful. They're hanging on to every little word. And when you walk out,
they're thinking about everything you said.
Like, honey, what do you, he said it. Why did he say it like that?
Yeah.
I think there's a great Seinfeld episode, if I can go to, where George goes to see a dermatologist for a mole.
I think I remember that.
Yeah. And I think vaguely, and he asked that, what is that? He goes, well, I don't know. We'll do a biopsy. And then he comes back to the apartment and he goes, I don't know. Why didn't it must be something serious, because if it wasn't serious, he would have said, get out of here. It's nothing. But he didn't say, get out of here.
And he's just reading into what he thought.
Right. Instead of saying, well, I don't know, let's do a biopsy, which is like, kind of a very, standard thing that a physician might say. He wanted to hear like, get out of here. This is nothing. Stop worrying about it. And so I think that's a parody of how people hang on to every word a physician says. So if you kind of even say jokingly, come on, this is no big deal, but just to be safe, let's do a biopsy.
Sure.
That goes a long way compared to, I don't know, well, let's just do a biopsy.
We'll find out.
Yeah, we'll find out.
I had that happen to me too with my son. He was sick. He had RSV. And I said, is he going to be he was so bad that I was like, is he going to survive?
Right.
And he's like, he should. And I just felt really uncomfortable,
right.
You're
trying to decipher what he should meant.
Yeah, exactly. And, I think people have had really great experience with doctors, and like any profession, and negative ones, right? And it has a big impact. I remember when my grandfather was sick, and I called you up because they had him parked at the St. Rose in like the hallway, because it was
I came
full.
to see him.
Yeah, and you walked in there, so I was calling you Puff Daddy, remember? Because you walked in there and you just went straight to the charts like you were a VIP. And actually, we found out from you that he was not going to that he was going to pass. But it was comforting to know why and how, versus before, if we didn't happen to know you, we were just sitting there waiting and had no end in sight. Yeah. So it's a great profession, and I think it's kind of sad to hear that it's getting, becoming bought out by conglomerates, right? And you're losing that. Because I remember growing up, we had a small family doctor, a pediatrician that we'd go to, and everybody went to him. And, so that's,
Well, I mean, if I can put a positive spin on it, I think I'm hoping that as physicians don't have to worry about the business side of it. They can actually spend more time being compassionate and
focus on the patient.
Because, one of the pluses of some of the changes is that the physicians, are not worried about payroll, and they're not worried about this or that.
Sure.
So, and let's, be frank, I think most doctors I meet are really compassionate people who are in it for the right reason.
Yeah.
So if taking some of that away from them can free them up.
That's a good point. Yeah.
To focus on patients, because, the amount of time you spend with every patient, if we can increase that and get rid of some of the other stuff by leveraging technology that they have to do, the paperwork and all of that, and they can spend more time face to face, that's going to make a dramatic difference in how the patients feel. Yeah. So I think leveraging technology and getting rid of some of the business end of stuff and letting physicians
focus on what they're good at.
Yeah, just spending time with their patients, understanding them. At the end of the day, I remember this interesting stat I heard when I was training, which is, a third of all visits to primary care doctors are for reassurance, I mean, there's nothing wrong.
No.
They just want to hear that there's nothing wrong.
Yeah.
And so physicians really sometimes, when you're starting training, you don't get that. You're like, well, how frustrating. Why is this person here?
Yeah.
But when you say, hey, 1/3 of my job is to say, oh, I hear you. There's nothing wrong. Don't worry.
Yeah.
But that's your job. That's 1/3 of your job.
Yeah. Yeah.
And get used to it, because that's what you signed up for, you know, to reassure people that they're going to be okay.
Yeah.
And that's not a waste. That's part of what you do.
Yep, which is awesome. Yeah. So let's, we had to ask you a hockey question.
Okay.
So I remember I admitted I was wrong when
was this? Can I get this? Is this recording?
When I said the pandemic, it's no big deal.
Yeah.
I still remember the first preseason game when the Knights played the Blackhawks, and you're like, look at how perfectly the Blackhawks are passing the puck and how much skill they have. Yes. And then we weren't trying because it was preseason, but and then regular season happens, and I think you guys never beat us, right? For a couple of years. Yeah. And then I would call and bust your balls. But, you know, if the Knights played the Blackhawks in the conference finals, because you're a fan of both teams now, who are you rooting for?
You know, my kids ask me this. It's difficult. It's like having two kids. I mean, how do you, I just root for overtime.
Exactly. Root for a good game. Yeah.
Root for a good game.
Yeah, but we all know who'd win. It doesn't matter.
I know. They're not looking good, the Blackhawks. But
better than we thought they would be.
Yeah. Thanks to Kane. I mean, that Patrick Kane. You know, I'm telling you something. You know, Patrick Kane has really evolved into a once in a lifetime player. I don't think people get it.
Yeah.
That guy.
No, he's amazing. Yeah.
He is so skilled.
Yeah.
I mean, he can carry a whole team sometimes, but
maybe we'll get him at some point.
Yeah. Well, actually there were some trade rumors right before the season started.
Oh, no way.
Yeah. But just of them trying to unload him.
Yeah.
But no, he's amazing. So, but yeah, it'd be a hard one to pick. So
last question, kind of a fun question. Yeah. So, you have kids, and I'm a dad, relatively new dad. Give me what's your all-time most epic, funny story, or something embarrassing your kids did that you I know there's probably a million of them to remember, but is there any particular story that you want to share? Something that happened with your kids? Anything fun, funny?
With my children, you know, I think one time I was telling my wife I was being interviewed on the news. Yeah. And I think so I got a text that I was going to be on the 6 o'clock news or something. Yeah. So I say, hey, you know, let's turn on the news. Yeah. And just see. And I guess they were like watching SpongeBob or something. And so I changed it. Yeah. And there I was. And I'm thinking, oh, wow.
They're going to be so proud.
They're going to be so proud. As soon as the piece is over, it's like, can we go back to SpongeBob? You're killing us. Like, okay.
Yeah, they couldn't care less.
They couldn't care less.
It's so funny how kids are.
Yeah, no one's impressed.
Yeah.
So they're a very tough crowd. You know?
So no more. You're done, right? No more kids?
Yeah, that's it. That's it. What about you? You're like...
I got two. I'm done.
You're like a factory. Yeah.
My wife is more over it than I am.
Are you sure?
Yeah, I think so. I think so.
Well, but, luckily, you know, I've seen your kids. They look like her, thank God. But, you should have more.
Listen, it was awesome sitting down with you, learning about, you know, coronavirus, your career, and I've always looked up to you as an entrepreneur, as a person, and you know, value your friendship and things like that.
More than you know too.
Thank you so much.
Thank you.
So tell us where can people find you on social, your website. Tell us a little bit about where they can find you and your businesses.
Yeah, so e7health.com and usdrugtestcenters.com, and as in terms of me, Jonathan Baktari MD.com. So those are three places that you can go, and we're on all the social media websites. So that's if you want to follow us and get updates on stuff. That's we do a lot of updates, especially on the coronavirus and stuff. So we try to do a lot of education.
And you're going to start that podcast soon, or what?
Yeah, we're going to do a podcast on YouTube, sort of like we were talking about earlier, like a expose on healthcare. You know, just what do you really need to know? when you land in an ER, how do you navigate an ER? How
Yeah.
do you navigate if your loved one's been admitted to the hospital?
Yeah.
What do you need to know, kind of thing?
Questions to ask, things
Yeah,
like
questions to ask, what to look out for.
That's great.
And that sort of evolved. Like, I wonder if there would be an audience for people wanting to know, what the inside story is when you're navigating the healthcare system.
I think they would. I follow your content on LinkedIn, and
Uh-huh.
I watched the whole video. It was very interesting because I don't think there's enough doctors out there really doing that, right? Not that I've seen. So I think educating the public about things that they care about or concerned about is huge. Besides going to WebMD.
Right. If you can personalize or get it down to a kernel, a small kernel of information that can just be easily understood.
Yeah.
So it's all about education and getting content out. So that's what we're going to try to focus on, try to get more and more education out.
Awesome. Well, everyone check out Dr. Baktari.
Oh, thank you.
Thanks again for coming on.
What
Appreciate
an honor.
it.
And I really appreciate the friendship, and you've been a close friend of mine forever. And thank you so much. Thanks for having me.
All right.
All right. Take care.
Bye-bye.
Bye-bye.